Hi, this is Supervisor Lawson-Remer. I'm here with my daughter, Ava Kai, to just talk a little bit about our initiative on making the county work for everyone. Hi, Ava Kai, say hi. um, and really, we're focused on this because the county for such a long time has been really opaque and really difficult to navigate. Because we had a different kind of leadership at our Board of Supervisors that was not focused on the economic and social rights of all San Diegans, and we're not focused on how do we expand access to basic things that everyone deserves and everyone has a right to, like food and shelter. And so that's what this initiative is about. It's about how do we overhaul our county from top to bottom, to expand outreach and look at translation opportunities, look at enrollment opportunities, look at all the barriers to access and what we need to do to overcome those barriers to access to make the county work for everyone. So thank you so much. And I'm really excited to be able to move this initiative forward this week.
I couldn't be more excited about the opportunity to build upon all of the incredible work that the County of San Diego Health and Human Services have done over the past 10 years to make the process better. Now we can work together to do the fine tuning to ensure that anyone seeking assistance not only can get it, but has a good experience.
Recently, I was denied continued benefits from when I initially applied, and I appealed that process, and it's still kind of in the appeal process. It's been a really lengthy process. I think I was denied August of 2020.
By creating an outreach, accessibility, and enrollment task force, the county can ensure that all families know about these services, can access and enroll in benefits, and they can stay enrolled as long as needed to meet their needs.
I got involved with CalFresh through my cousin Kenny. I had applied for CalFresh once before and they turned me down because I was on SSI and I received some money from the state. And I guess the laws have changed since then, and that's how I was able to get it.
Food insecurity was also something else that was just another, we can say another issue that they had to contend with. And so knowing that they had these services available and they qualified for them was a big relief for a lot of families.
I lost my medical insurance. It was bad. I lost my depression medication, and I lost my diabetes medication. And before, I was just lived in the dark, stayed inside. I didn't see the point. I felt hopeless. Getting CalFresh and Medi-Cal has helped me get hope, direction, and focus to get back to where I was before.
One client that I've been helping recently, and so she's elderly, and she doesn't have a computer or a phone. The only reason I was able to get in contact with this particular client is because her driver / caregiver, I'm not sure the exact title, was able to sit down at the table with her, masked, never mind, because these are elderly folks during COVID, and share the telephone with her. And I would ask the question, then the caregiver would ask the question of the client, and kind of back and forth that way.
However, the barrier, in my opinion, that has the greatest negative impact on successful enrollment and retention is caseloads, or more specifically, the amount of time given for the HSS to review and complete intakes, renewals, or mid-year reports. The time management has allotted the HSS to review cases was determined a decade ago. The insufficient amount of time allotted for case review has a direct impact on accuracy rates of appeals, approvals, and denials, and has led to the county's accuracy rate for CalFresh to be below state program mandates.
That invalid denials and discontinuances are consistently one of our top 5 quality control errors. Now, we can't change the federal rules to those programs at this level, but we can allocate the resources necessary to give our clientele the time that they deserve.